So welcome to Family Meal at Rethink Holiday Edition.
I can see the sweater.
Yes, yeah, the sweater. Thank you so much, Congressman, for being here today. You know, Rethink's been really inspired by all that you've fought for around food security and here in the U.S. We had the privilege of meeting in August of 22 when you went on your nationwide listening tour. Your advocacy was instrumental in the White House Conference on Hunger, Nutrition, and Health last year. 2 years ago now. Yeah. And we truly appreciate all the work that you've done. You know, this is meant to learn more about you and hopefully to inspire folks to kind of join the movement that Rethink's trying to create around equity and sustainability in the food system. But I'd love to really learn more about how your journey to Capitol Hill, and then also what led to your strong focus on food.
When I was in college 100 years ago, I actually was an intern in the office of Senator George McGovern, no relation. He ran for president back in 1972, lost 49 states, but won Massachusetts. So anyway, this was in the late 70s. I really admired him. He was a leader in the effort to end the war in Vietnam. But one of his focuses was on ending hunger. But I sat through countless hearings as he explored the issue of hunger in America. And I just remember as a college student being kind of horrified that in the United States of America, I mean, the richest country in the history of the world, so many people were hungry. Yeah, he lost in 1980, and then I went on to work for a congressman from Boston, and then I got elected myself in 1996. And as I was traveling my own congressional district, I would encounter people who would tell me that they couldn't put food on the table for their families. And I thought that just shouldn't be the case in this country. Food ought to be viewed as a fundamental human right for everybody. In any event, I decided to focus a lot of my attention on the issue, and that's what I've been doing. I've been trying to expand programs like SNAP and WIC, and I've been an advocate for universal free school meals for children everywhere, trying to improve the quality of meals for programs like Meals on Wheels. I mean, I know you guys are also very interested in making sure that people have not only food, but really good food.
Yeah.
Hunger is a solvable problem. Yeah. I mean, we have the money, we have the infrastructure, we have the food. What we've lacked is the political will, and that's why hunger, in my view, should be viewed as a political condition.
And I think that really what we see more and more, especially in New York City, is this branding of it's not the 1920s bread line anymore. It's everyday people who are, they're just poor. And that's what we're focusing on more and more. We think let's just buy everybody lunch.
Right.
And let's save them the $12 a day.
We have to be at where people are. Leading up to the White House Conference, we did a big listening tour all across the country. I'm kind of ashamed to admit this, but I didn't realize how many people who have apartments may not have kitchens.
Yeah.
Or may not have pots and pans. So I can give you a bag of fresh produce or groceries, but if you can't prepare it, so I think we have to approach this issue in a way that it works for the people we're trying to support. And people like me don't always know what that is because my lived experience is different. So you have to listen, and you've got to, make sure that what you're doing is really helping people.
A lot of challenges that we have is how do you measure impact, and how do you actually, you can drop off 1 million pounds of food, but was that food consumed?
Right.
Was it enjoyed? And so have you seen anybody kind of focused on either standardizing metrics across nonprofits or government, or anybody who has some type of advanced metrics that nonprofits and, government institutions can look at to really figure out, are we hitting the right number? Are we doing the right thing? That's not just how many meals did we drop off?
At the federal level, when you talk about measuring results or measuring success, is that so much of our time is consumed by just trying to prevent cuts in existing programs. I mean, I sit on the Agriculture Committee from Massachusetts, and so much of the debate on SNAP in the Agriculture Committee is basically demonizing the people who receive it, which I find so offensive. you ought to go where people are or who are receiving some of these benefits and understand, one, their reality, and number two, understand that the benefit is almost nothing.
Yeah.
I mean, the average SNAP benefit is a little over $2 per person per meal. I think they would realize that, one glove doesn't fit all, and that, we've made some progress, but we can make more progress. But again, that's not where the focus of government is. The focus of government, unfortunately, is about beating up on people who are vulnerable, who are struggling in poverty, and basically saying the reason why you're on SNAP is because you're not working hard enough. And you know as well as I do, the majority of people on the program actually work. You have a movement in Congress now about trying to limit what people can buy with SNAP. And, because, we want everyone to be healthy, right? I get that. But the way you do that is you incentivize people. You don't further micromanage the program to say that you can't buy, a soda for your kid on his or her birthday, right? And we have this program called the GusNet program, the double up bucks. Often a lot of our farmers markets are benefiting from, and our farmers are benefiting from it, where you get more value if you buy fresh produce, from local farmers at farmers markets. And we're finding that people are utilizing it.
See, that's a really positive metric. Like, you can see that people are doubling down at farmers markets, supporting local agriculture, and that's a great story.
And so as we approach a new farm bill, I'm hoping our farmers will be on Capitol Hill advocating for a robust SNAP program. I'm hoping our supermarkets will do the same thing, because they're benefiting from this program as well, because people are buying stuff in their places of business.
We've been really, really kind of laser focused over the last probably 2 quarters at learning about and partnering with organizations that are providing medically tailored meals through a waiver 1115. And do you think there'll be some impact on the affordability crisis?
Well, we need to make sure those waivers continue, right? And I have a bill I'm trying to get attached to an end-of-year spending bill that would provide a pilot program within Medicare on medically tailored meals. One of the reasons why people who are going through cancer treatments or through serious health issues, one of the reasons why they, after they're released from the hospital, end up back in the hospital prematurely is because of lack of access to nutrition. And so one of the things we're trying to say here is that, okay, if you're not moved by the moral imperative to actually help people, and all you care about is saving money, this is a way to save a boatload of money in our healthcare system. Nutrition needs to be a bigger part of healthcare. Boston Medical Center, was one of the first hospitals to have a food pantry at the hospital. And they do they do food prescriptions. But the doctor who started this, she delivered babies, and she said, this is years ago when I first met her, why did you end up putting a food pantry at Boston Medical Center? She says, because I was tired of delivering dead babies. The lack of nutrition in this community was resulting in really horrible outcomes. And one of the things they realized was that patients were not eating the food.
Yeah.
And the reason why they weren't eating the food at the hospital is because it looked bad, tasted bad, and smelled bad.
Yeah.
So they actually went out and hired a really good chef to come in and to revamp the program, and he did. And so the meals the patients were getting tasted and smelled and looked like the meals your grandmother used to make, right? And the people loved them. This is not rocket science. It just requires somebody to just do it. And the final thing I would say is we're also pushing a bill to require that if you want to become a doctor in medical school, you have to take a course on nutrition.
Yeah, we see that continuously, more and more and more. And, have a shout out to the what they did in the hospital system in New York, making the first 2 options plant-based.
Yes, sir.
Was incredibly helpful, and that's Rachel Ashton and Kate McKenzie got that done. One stay in the hospital can get, 1 month of food?
6 months.
6 months of healthy food. One night equals 6 months of healthy food.
But if you're the most conservative person in the world, that statistic you just gave should compel you to want to be more engaged in this issue, because think of the savings here, right? And what you could do with that savings is you could, help end hunger in this country.
And if we can align this and get that messaging down to being like, hey, you're saving so much money and you're making so much impact this way, I actually am hopeful that we're going to be able to make some impact, because this is about efficiency. It is about cost savings in a big way, but it's about folks' day-to-day cost savings.
And I also think it's about respect for individuals. I grew up in a family, where, meals are important. And for some people, it's a nightmare because they just don't know where they're going to get it from or whether they're going to have anything that's any good. There are best practices in place. You guys rethink food is one of the best practices, right? We need to have you grow and grow and grow as a model. We know that. I mean, there are others as well. So let's just do it, right?
Yeah.
And what we should be doing, talking about on the federal level, is like, what can we do to be wind at your back? How do we take these models and bring them to a larger scale?
We always ask everybody, where's something that you've kind of run full force into, stub your toe, and learned from it to help you kind of, change your decision making and grow them?
When I first got into this, I didn't really know a lot about the realities that a lot of people in this country face. I've learned that it's important to connect the dots more. I talked to you about how my farmers are beginning to, I think, appreciate programs like SNAP a lot more. But we're also trying to make connections because a lot of people, like, their impulse is to want to do the right thing, but they don't know what the right thing is or how to do the right thing. I'm learning every day, right? We all learn every day.
Yeah.
And every day I learn about an individual situation that impacts a family that is more complicated and more challenging than I could have imagined. But when you learn about these complicated situations, then you need to try to figure out a way to respond to it and to help them. At the end of the day, for me to be successful, I can't be too moralistic. I can't just simply say that if you're voting against these programs, you're an idiot. I can't do that, right? I'm trying to focus on powers of persuasion. How do I persuade somebody who has been hostile to some of these programs that maybe they need to kind of rethink their position? It's not about me being right or you being wrong. It's about how do we move the ball forward. And that was the whole point of the White House conference, right? We had Democrats and Republicans come together, second White House conference on hunger, nutrition, and health ever held, but to bring a whole bunch of people in the room, including some diverse political people, and to have a conversation about this and to figure out how do you solve this problem. The people who should be interested in the stuff we're talking about today is not just anti-hunger advocates. It's our medical community. It's those who care about climate change. I mean, there are all kinds of groups that should be involved in this.
We ask one continual question on every on all three of our podcasts that we've done here. What's the best advice you were ever given?
I think the best advice I was ever given was from Senator McGovern, who basically told me, never give up. One of the things I'm really proud of is that after he left the Senate, he became the ambassador to the Food and Agriculture Organization in Rome. And Bill Clinton was president, and I was in Congress, and he asked me to set up a meeting with Bill Clinton to talk about a global school feeding program that McGovern wanted to launch. And we had a meeting, and George McGovern said, Clinton said, what can I do for you? And George McGovern said, Jim, why don't you begin? And I was like, we had a global school feeding program in the poorest countries of the world to get more girls to go to school and to get better educational outcomes, because you can't learn if you're hungry. And then Clinton said, how much do you need? And I was like thinking, I don't know, $1 million. And George McGovern said, $300 million. I was like, oh, God. And Clinton said, does anyone have $300 million? And Dan Glickman, the then Secretary of Agriculture, said, I can find it. And in any event, that program, we had a pilot, and then I turned it into legislation. That program is up and running and feeding tens of millions of children in the poorest countries in the world right now. But yeah, we can't give up. I don't know how many more years I've got. I hope a lot. But I want to see hunger ended in this country.
For some reason, I thought that it was taken care of. Do you know what I mean? Like, because I ate at restaurants. I always ate at the restaurant and this, but I was always like, but there must be free pantries everywhere all the time. Like there's no way. And then when I started volunteering, and then when I saw that the quality of the food was the genesis for Rethink too.
And one of the things that we're facing now is that hunger is going back up in this country. I mean, during COVID, as horrible as that was, we saw hunger go down a little bit because there was more federal resources, being invested to make sure people had access to good, nutritious food. That all sunsetted.
Yep.
And now we see a spike again. I mean, we have a defense budget that's so big that I think even Dr. Strangelove is impressed. We're spending $1 trillion building more nuclear weapons than if any of them were ever used that ends like on this planet. And it's like, what the hell are we doing, right?
Yeah.
I mean, at the end of the day, national security should be that, people should know they have enough to eat for themselves and for their families. We have a lot of work to do, but there are a lot of good people. I mean, it's been wonderful to not only get to know you, but to see Rethink Food kind of take off. And it's a really neat model, and it's effective.
So we had AI make some questions in the AI bowl. So we're going to pick one out right here. Do you want to pick one or no?
I'm going to try. No day. What's the worst meal you've ever had at a political event? And did you eat it anyway or find a diplomatic way out? I go to a lot of the things where the food is lousy, right? So I've been really good about chewing the food and spitting it in my napkin, and then this is what's gross, I know, but but some of the food is inedible, and oftentimes bad coffee too.
Really?
Yeah. So,
according to World Health Organization, there are 650 million people that have obesity, and around 540 million people that have diabetes, and these numbers are growing. And for diabetes, they project by 2045 this number to be around 750 million. You mentioned something about government being involved and nutrition being part of the good eating and good health conditions. Would you say government being involved with the bigger companies and trying to help them taking more social responsibility in that?
We already see some companies moving in the right direction. I mean, look at the soda industry. I mean, they're now going more and more into, seltzers. One of the things I want every state in this country to do is to integrate nutrition kind of in the school curriculum. You can teach nutrition through the lens of math or science, but things like that we can do. We want universal free meals in all of our schools. Every state should do this. Massachusetts recently did it. You take the stigma out of school meals, but you also have an opportunity to introduce good, healthy food. People can try different things. What I don't want to happen is this to be an effort where we say, okay, you're on SNAP, and so you know what? We're going to make your life more difficult. I'm going to limit. I'm going to micromanage what you can buy, with no regard to where you may live and what you might have access to. I think that's a lousy way to do it. It's offensive. It's like it's treating people in a way that none of us would want to be treated. The better way to do it is like enhanced GUSNIP, which is the Double Ups program, to give you more purchasing power if you buy fresh fruits and fresh vegetables. And again, we have to meet people where they're at, and that may mean that prepared meals, maybe something. And the final thing I want to say is our medical institutions need to know more about nutrition. Our doctors do, our pediatricians do. Yeah. And the private sector needs to be, right? Our insurance companies need to be covering more nutrition-related benefits. Cooking classes are not a bad thing, too. Because I'm going to tell you, the amount of people that do not know how to cook is higher than you think.
And so it's hard for schools to argue like it's important to take. And even though there's a lot of demand, and of course that's canceled. So why is so hard over there?
So think about that. excuse why they don't teach nutrition, because it's not on the tests, right? Well, then add a couple of questions on the test. I mean, what's the big deal? Add a couple of questions on nutrition, if that's what it takes to offer the course. But the other thing is, how about offer courses that we actually think are going to be useful in maintaining the health and well-being of the citizenry of this country? Stop it, right? I mean, just do it, because it's the right thing to do. To not do it, I'm tired of the excuses, right? They ought to just do it. That was one of the things that we talked about at the White House conference. And everybody was like nodding, and here we are, a couple of years later, and we're getting all these excuses. But we need to stop the excuse, and we just need to do it.
At the federal level, what is preventing people from just doing it?
If there's a cost involved, that sometimes prevents people from moving forward. Sometimes it's a lack of understanding what the realities are, and sometimes this is not a priority. We also need to strengthen the movement toward nutrition and toward battling hunger and food insecurity, right? There needs to be more impatience around these issues. And we also need to start getting, entities like the Congressional Budget Office, which scores, the cost of legislation, to understand that, investing in nutrition will actually save you money.
We should try to measure the amount of money we would have saved if we would have put this into place 10 years ago.
Yeah. No,
so you get that number, it's probably billions.
For a whole bunch of reasons. The evidence is so overwhelming on this stuff. We just got to do better. We just got to do better. And we're going to have, again, we're entering a new political period in this country. It's going to be a little bit more difficult to have some of these conversations, but we're going to have to find a way to do it. And we're going to have to make some unusual alliances and maybe talk about this stuff in ways that, play to whatever the more conservative elements in this country think is important. And that may be cost savings. And I think everybody here appreciates the fact that, food is love and food is joy, right? But food ought to be, again, a fundamental human right for every person in this country on this planet. I mean, there's stuff we can live without. Food isn't one of them. I mean, you work with wealthy business, leaders, as well as with nonprofits, as well as with people in the community who are at risk. And, you get some good stuff going on here.
And the small businesses and the communities we serve, that's been the home run. They know how to make the food for their community. They get it. They know what people want. And then by teaching them to be strict about our guidelines for per the nutritional value of what we're distributing, right. We found that we've had a big uptake in the communities we serve.
Thank you. Great.